So with this question and the one I posed earlier about TMS making depression worse, anxiety making depression, or TMS making anxiety worse, what about the dip? Let's talk about the dip a little bit.
The dip on the weekend?
The TMS dip, right? We hear everybody complain. I went through this horrible dip where my anxiety was worse, my depression was worse, and I mean, I see this here myself. People come in about week 2, week 3, and it's almost as if I've never seen somebody be worse than when they started, but I have seen them dip back down to, so if they were at a GAD 7 of 12, you know, and all of a sudden they're at a 15, depression at a 19, and they got to a 12, but now they're an 18 again. Like, you don't understand what I'm saying?
Yeah, yeah. I think I do. That people don't get well in a straight line.
Yes.
And that is true for virtually all of our treatments. It's true for medications, where people will have steps forward and then a step back, or a step sideways, and then things will the trend will pick up again. In psychotherapy, people very often will have improvements and then some backsliding. And I don't have a good explanation for why this happens, but phenomenologically, it is something that people see, where it's not a straight line. And in general, I encourage people to try to step back, look at the big picture, look at the overall trend, rather than is it a good day or a bad day.
Yeah.
And certainly, when people have depression and are not in TMS treatment, they're just taking their meds every day. Are there some better days and worse days? Yeah. Even when people are remitted. As one of my patients put it to me back in the 90s, it's like, well, Dr. Cook, when is a bad day just a bad day, and when is it the start of another depression? And the answer now, as it was back then, is we can figure it out in hindsight, but in the moment, it's alarming.
Yeah.
And I think the thing to do is to take a deep breath, recognize that there is natural ebbs and flows in life, and to look for the trend. If it's a bunch of days in a row, that's worrisome, and may merit reaching out to one's physician and say, hey, I'm worried that things are coming back. And if it's just a bad day once in a while, that's I think even the healthiest among us would say that's kind of part of life.
Par for the course.
Yeah.
So what would you say the best thing to do, minus reaching out to your physician? What would you say the best thing to do during the dip?
I think that what I encourage patients to do is to first have patience, and to do whatever coping techniques they have developed over the years to try to relieve stress, and to take good care of themselves. So whether it's physical exercise, whether it's something that's recreational, like listening to music that puts them in a better frame of mind, whether it's meditation, whether it's connecting more deeply with friends and social contact. There are lots of things that people have figured out for themselves as to what helps them to modulate their mood when they're having a bad day, and to redouble their efforts to do all that stuff. And very often people recognize what they need to do, but putting that into action is often hard.
Yeah.
And especially if a depression is coming on, it's people will say, I know what I should be doing, and I just can't do it. But conversely, as they start to get better, I've had other people say, oh, all that stuff I learned in CBT and in DBT that I couldn't actually, it's like I knew what I should be doing, but I couldn't make it happen. And now that the depression is lifting, I can do it.
Yeah.
I can recognize that I'm catastrophizing. I can recognize that I'm making a mountain out of a molehill. I recognize that that my internal narrative is just making me feel worse and worse and worse, and now I can stop it, or try at least.
Yeah.
Whereas before it was like, I can't do it, would be what they would say.
Wonderful.
And that's often the way that TMS works well synergistically with therapy, where people will say, the stuff that I learned, I did the homework, I did the workbooks, I know intellectually what I should be trying to do, and I just can't quite make it happen. And now I can.
YouTube, do yourself a favor. Check out this next video right here.
That's the one to look for.